Welcome to our December North Carolina Maternal Health Innovation Community of Practice. This month's session is Multi-Agency Coordination for Postpartum Health. An example was Infant Safe Sleep with Neha Saggi. We're so excited to have Neha with us today. I'm going to go ahead and spotlight Neha and let her introduce herself and give some context to her work. And we'll turn it over to her.
Awesome.
Thank you for being here.
Thank you. Thank you. I'm going to go ahead and share my screen now and just pull up the slides. So is everyone able to see my screen? Title slide? Great. So thanks everyone so much for having me and inviting me to talk to you all today. My name is Neha. I use she, her pronouns. I'm currently an undergraduate at UNC studying public health and bio and chem and everything that puts me on the track to hopefully go to medical school. And I want to work in women's health and public health somewhere in that intersection one day. So that's where the interest in this project and everything that came from it started. And so I'm just going to start by orienting everyone a little bit as to what I did and why I did it. So first, just how I ended up here. The program that I'm in at UNC, the Moorhead Kane Scholarship, provides me with funding to spend a summer abroad exploring an interest of mine. And so the interest that I wanted to explore was the intersection of women's health and community health somewhere in a health system that looks a little bit different than the United States. And so I had spent some time at Carolina with Dr. Tully and the postnatal patient safety learning lab, learning about women's health and how it intersects with public health. And I ended up, when I was planning the summer, reaching out to Dr. Tully and saying, do you know anyone who I could work with and learn more about this field with? And so she connected me with Durham University. So I like to say it's the original Durham because I know a lot of us may be from the area in North Carolina, but this is Durham in the United Kingdom, and it's they're in their medical anthropology department, or their anthropology department has a medical anthropology subsection, and in that subsection of the department, they have a center for safe infant sleep. It's called the Infancy and Sleep Center, and that's this third picture on the slide. So Dr. Tully was able to connect me with the PI at that center, Dr. Helen Ball, and I got to go and spend 7 weeks with her and her team, learning about the work that they're doing and getting involved with their projects. So I got to do a few different things, including learning about midwifery and health visiting and continuity of care. But I'm going to focus on the main formal research project that I got to contribute to while I was there, and that was focused on multi-agency work to promote safe sleep throughout Durham County. So to just go over what the project was first is the Durham Infancy and Sleep Center, which I call DISC, is focusing on infant sleep in order to address it at many levels of the issue. So one of the things that I'm sure many of you know about promoting safe sleep is that it's affected by so many things beyond just the clinical encounter. So things like, if you have unstable housing or a lower income, those social determinants really impact your ability to allow your infant to follow those safe sleep guidelines. Another issue is that the guidelines themselves have been changing pretty frequently, especially in the UK. So someone who had their first child a few years prior to their second child might be given different guidelines for their second child and might be confused about what they should be following and what the correct practices are and the safest practices are. And then the messaging they're receiving from different parties, so maybe what they're hearing from their midwife or what they're hearing from their general practitioner might be different based on those changing guidelines. So the goal of this project was to really address all those sort of inconsistencies in messaging and also provide messaging at additional levels to beyond just the clinical encounter. So the goal and the reason for the title of this project was to get more people's eyes on the baby. So that's where the name came from. And it's throughout the county of Durham, so pretty substantial population of people, and it targets specifically vulnerable families. And there's sort of two prongs to the project. So first, the academic center at Durham and a few other institutions were tasked with designing a training program for different groups of people throughout the county, which I'll get into in a few slides. And they created a training program and implemented it throughout the community. And then the second stage was the evaluation stage. So seeing how well that training worked for these members of the community and what they thought of it and how accessible they found it. And then at the bottom here are just some of the organizations and funding areas that were involved in the project. I want to point out that the NHS, so the National Health Service, was involved for the whole county. And also it's worthy to note that the Lullaby Trust is a major nonprofit that focuses on safe sleep in the UK. They were also involved in the messaging for this project. So it was pretty widely contributed to from a lot of different areas, and it was really, really exciting to be able to be part of. So one of the first steps of the project, and this graphic on this slide that I was tasked with creating, was to identify what already exists to prevent unsafe sleep. And so one of the categories that unsafe sleep falls into of causing is sudden unexplained infant death. So, any of those factors that can contribute to an unexplained infant death include things like unsafe sleep, also things like sudden infant death syndrome, which I'm sure many of you have heard of before as well. So this map here outlines all of the points of contact between existing health practitioners in the county throughout the postpartum, the antepartum and the postpartum period, and where specifically safe sleep was intentionally addressed. So those little moon icons kind of identify where direct safe sleep information was provided. And of course, this infographic starts at 16 weeks. Of course, you would probably see your provider before then, but 16 weeks was the first place where safe sleep was explicitly addressed. So that's why this graphic begins here. So as you can see, the red circles indicate antenatal visits, and these are universal. So everyone in the county should be receiving these visits. And between 16 to 18 weeks, the community midwives are tasked with explaining to families using UNICEF's Caring for Your Baby at Night information packet, explaining to families how, what safe sleep practices entail, how to make sure you're following the guidelines, and answer any questions that the families might have. So that first indication of what safe sleep means and how important it is comes in that 16 to 18 week period. And then it's not revisited again until 30 to 34 weeks. So, and it's again, the community midwives using the same information from UNICEF again. So it's not new information, it's exactly the same. And it's really just being reinforced. These green circles are the enhanced parenting support pathway. And that is a specific program in the county that is tailored toward young first-time parents. And many of them would qualify as low income as well. So they have 4 additional visits from specific practitioners who come and assist them with anything that they may need in that period that's really close to the birth, leading up in the few weeks right before. And what's important to note there is that the only time that they're addressing safe sleep is at 39 weeks, which is often a little bit too late to create a new major plan for where the baby's going to sleep, how they're going to, be kept warm and fed and all of these things. 39 weeks is a bit late to address those things with these families one-on-one. So that was one issue that was also identified. And then the rest of the map just lays out, all the other parts all the other moments where safe sleep is directly addressed. So of course, the first day the baby's born, midwives are going to discuss it. Again, they use that UNICEF information, and they also use information from the Lullaby Trust, which is that organization that I mentioned on the last slide that was part of this project as well. And then really not much information until 10 to 12 weeks postpartum. And that there isn't any specific guideline for that. The early help practitioners are just instructed to revisit safe sleep information, not really being told to use a very direct source of information, just whatever they feel is appropriate. So this whole map or roadmap that I outlined was the starting place for what the safe sleep guidelines and explicit provisions of information were. And we kind of use this to build on what already existed and sort of address all the areas where there are gaps and where information can be provided and how clearly it's provided as well. So then we did the training. And this slide sort of outlines the three main groups of people who were trained within this multi-agency workforce within the entire community. So this first group in the red are people who encounter vulnerable families occasionally as part of everyday work. So people like housing officers or landlords or maintenance workers of some sort who might enter a home and see something that might be unsafe, and if trained, could notice it and mention something to the family. And that is really relevant because if they have the important information and the correct information, they could really make a huge difference for these families if they're able to provide the information in a way that is productive and not, patronizing or some other form of conveying information that makes families feel like they're doing something wrong, but really is just meant to assist them. So that's the first group who went through the training. The second group is people whose job already is to support vulnerable families, but who may not be direct health practitioners. So a good example of this would be social workers who directly work with families and are trained in having these kinds of conversations, but may not have relevant information about safe sleep in their toolkit already. And so for them, it was mainly about raising awareness of what causes sudden infant death and help families think about unplanned scenarios where what would happen if, the heat wasn't able to turn on this evening or something like that, and how can we address that problem? So they're more directly working with these families on a regular basis compared to the other first group who may just randomly enter a house as part of their daily work. And so another aspect of this second group is the ability to advocate for the families, because that's part of their role already. So this was also taken into account in their training. And then the third group was health practitioners. So people who probably already know a lot about safe sleep and how the guidelines are always changing, and who may just would like to reinforce, what's the best way to approach it with families, how have things changed and why over time, and how can I make my advice more tailored to vulnerable families who may be at higher risk anyway. So, and then the other aspect of this group was also to provide support for the other two levels and other two groups who might refer families to them. So that consistent connection and coordination between these three groups is provided through having health practitioners in the trainings as well. So that way, for example, a housing officer who saw an issue could tell a family to discuss safe sleep further with a health practitioner who's also been trained by the same training and organization. So those are the three levels of the training. And now I'll get into what they actually learned in the training. So the first strand, which is the people who may be on their day-to-day work, would see and interact with these families. They learned about kind of what the risks are for unsafe sleep and what to notice when they're in those settings, and then what to do. So their training was less specific than the other two groups, and it was mainly just what is the problem and how can I potentially address it and refer families to further resources from there. The second group, because they already have this level of interaction with families and this level of trust with families, their training was more specific to warning signs for infant sleep safety, as well as what's changed over time, because they've probably been involved with families over a longer period of time and have seen the guidelines change. And then also talking about how to tailor messages more specifically for families, rather than just providing universal messaging the way the first group might. And then the providers, of course, they probably already knew the most about what safe sleep entails. So they had some more targeted information about specific aspects of the guidelines that have changed over time, such as co-sleeping advice, or like things that affect vulnerable families specifically. And they also received training on how to tailor their information, and refer to other more specific providers, beyond the general practitioner level as well. So this kind of encapsulates all the things that they learned. And then this bottom timeline just lays out when they did what. So first, they would register for the training, and it's registration only. So it's not publicly available. You have to register for the training to receive it and then complete it from there. So they would register, and then they would take a pre-survey to assess their knowledge on the topic before they do any training. Then there's a series of videos for them to watch and sort of survey quiz questions for them to fill out as they go. And then at the end of the training, they do a survey to assess their knowledge at the end of, how much they've learned over the course of the training from there. And then in the months following, there were evaluation surveys and focus groups to see what went well, what didn't go as well, and what could be improved for projects implementing this training in other counties as well. And then here's just a link to the training platform if anyone is interested. It just looks like this. You would click on registration form and sign up for the training, and then you'd be taken to the videos and the questions. And it's work through at your own pace. And you're given, I think, if I remember correctly, it's a month to complete the training, and complete the pre and post surveys as well. So this is just here if anyone would like to look at them on their own time as well. So that was what the training was, and now I'll discuss a little bit about how it went. So for uptake of the training itself, one thing that's important to note, this first column or this first bar of this bar graph, a lot of the providers, this green group on the graph, they were automatically enrolled by the district, by the hospitals that they worked for. So a lot of them maybe didn't even know that this was something that they were able to use. Maybe it got lost in their email or something like that. So they had a pretty major drop off between the people who were registered for the training and the people who actually logged on to the platform in order to complete the training. So we see, only 37% of them, this green line over here, the 405 to 150 people, only 37% actually logged on. But then from there, about half of them actually completed the training, which is more encouraging. And then another thing about this graph that I think is relevant is that in the red group, which is again the people who would occasionally interact with the families and who probably know the least already about safe sleep, they had a very strong registration, log on, and completion rate, which just is encouraging for us to see that people who weren't necessarily already involved in this field and discussing safe sleep with families were interested and stayed interested throughout the course of the program, and then felt like they could really make a difference afterward. But again, overall, the uptake from registration to logging onto the platform was about 57%, and then completion of the training from those the original registration was about 40%. So if people logged on to the platform, they were pretty likely to complete the training, but the biggest step between enforcing the actual completion of the training was between registering and logging onto the platform. That was the main difficulty. So that's kind of just how things went in terms of starting and completing the training. The impact was something that I really enjoyed getting to learn about, because we did it in a few ways. We were able to do focus groups where people told us directly what they thought. And then we also had some surveys and some other meetings of some of the community leaders in each of these categories of people. And these are quotes from both the surveys and the focus groups. So the things that I like to point out here are that first, the paramedic in the big red box was able to notice a few things that they may not have noticed before. For example, how to safely position a baby for sleep in a blanket, and noticing that, for example, there's a pet, a house cat, and other sort of signs around the house that they thought were worth noting to the family, just to make sure that they knew how to navigate what safe infant sleep looked like in their specific house. And they were able to also refer the parents to other groups and services that could help them navigate further beyond just that paramedic's involvement. Which is really great to see, because that's really the main goal of this program, is to get people involved who may not have known about it in the first place, and help them just contribute to these families and the safety of their babies. And just like providing that information in the first place is so important. So that was great to see. And then also it's been cool to see that the people who got trained didn't just share it with families, they shared it with their colleagues as well. So this housing officer in the lighter pink color is able to coordinate trainings with other housing officers and provide resources to other people in that similar role, beyond just getting trained by the Eyes on the Baby program. So that was great to see as well, that people are sharing this information beyond just their own, practice on their daily lives. So that was great to see as well. And then, of course, it's great to see that a community midwife feels more confident about having these discussions, because that was the goal for these providers as well. They already know that they need to have the discussions. It's just about how well it's being delivered and how productive those conversations are. So that was really great as well. And then for the middle group, the early help practitioner or social workers, they gave a lot of information about specific scenarios where they were able to make a difference for these families. And I think the greatest thing about this quote is that they say that there was a non-judgmental discussion following their bringing up the topic, which is really the goal for this group, for understanding that, they have these difficult conversations with families where they say, like, this may not be safe for your child, but they're doing it in a way that's productive and actually helpful, rather than being patronizing or judgmental in a way that wouldn't be as productive. So that was also really great to see for the impact of the training for all these strands across all the groups. And then I just wanted to leave a few major takeaways of why this kind of work that involves people across all of these levels of a community is so important. So like I said earlier, it just increases access to information, because you're not only receiving this advice in a clinical encounter with your general practitioner, your midwife, you're getting the same information from, your landlord or the paramedics who come to respond to some kind of emergency. Everyone around you in the community has this access. It has access to this information and can help you understand it better, beyond just going, online and finding, incorrect information on a website or something like that. You're getting it from people who have been trained, which is really just so important to come from places that aren't just your nurses and doctors. And then it's also preventative and proactive. So it's not a response to an event that's already happened, right? It's upstream, and it's addressing issues that could lead to something really tragic happening, but it's not a response, which is also just so important. And then it's also consistent. So like I said, the guidelines change so often for these families, they're confused, and it's also difficult to find information that's standardized online for a lot of them. A lot of them showed me, Facebook groups and things where they were seeing this information and getting confused because it was different than what they were hearing from their midwives. So this consistent messaging is so key to having effective multi-agency work, because people at all these levels are providing the same base information at different levels of specificity to everyone in the community. So those are kind of my three main important takeaways from the project. I'm so thankful that you all listened to everything I had to say about this project. I want to turn it over to North Carolina Safe Sleep in order to provide some information about safe sleep in this community. So I'll go ahead and stop my screen share.
Hey, thank you. This is Megan Kennedy with the UNC's Collaborative for Maternal and Infant Health, and I help to coordinate the Safe Sleep NC project. I'm going to pull up just a few slides just to let you know what supports are here in North Carolina. And I just wanted to first say what a beautiful demonstration of a project that really shows that safe sleep takes a lot of hands-on, multiple people singing the same song when it comes to safe sleep. And the work that I'm seeing there is very similar to what we're wanting to pilot. We're going to start working on that come this spring with some of the different counties that we're going to be working with. So it's very similar to that type of approach of, what training do we have? What is the message that we're sending? And so for those of you, we just want to let you know what safe sleep resources are available. Everything that I'm going to talk about briefly here can be found at safesleepnc.org. And we also have a website dedicated for Spanish-speaking parents and caregivers. Also, there's a lot of resources on here, but just to let you know what is available to you now for the work that you're doing with these parents. And I love that map that you showed, that these conversations should be starting early on, prenatally. We know that parents are, setting up their nursery, receiving gifts. We want them thinking about where babies should sleep early, and then often those different points of contact. I really love the universal messages and then the targeted messages to vulnerable families. That's so needed. So here are some handouts and posters that are available. These can be ordered for free. You can follow this survey and just look for the safe sleep category and order these. If you are in North Carolina and serving North Carolina families, you are eligible to order these for free. These come in English and Spanish. Free staff training. We are currently updating our online training for staff. In the meantime, I am always available to provide virtual training. We usually have these for about an hour. We can tailor them for what your group needs, who you're serving. We really just go through, again, the trends that we're seeing, the latest recommendations out of the AAP, and then really like what was discussed is how to have good conversations, right? It's more than just letting parents know the recommendations. It's working through how to reduce risk, how to support them, and how to really meet them where they are and having those non-judgmental conversations. And then also just, again, pointing staff, pointing agencies to available resources that are out there that are always for free when you're working with us. We've recently created some short 4 to 6 minutes, depending on the language, videos that are targeted for parents and caregivers that really go through those key recommendations, and then also, just very supportive, pointing to more additional information that parents might need to help answer questions they have regarding safe sleep and how babies should sleep. A lot of those questions we answered in these short little, typically 1-minute reels where experts from the community here in North Carolina answered often those really key questions that parents may or may not be asking, but really are often the drivers of why they are not practicing safe sleep recommendations or are reluctant to. So these address, again, those key questions. And we have these available in English, and coming very soon will be Spanish. So there's 16 of them. So we cover a lot of questions that parents might have. I would also encourage people who are working with families to perhaps review these. There might be something in here that might be helpful when you're having those conversations, because we know that conversations are going to be the most effective. We also have a pretty robust social media toolkit. So one way to get that message out, to start to have a universal message, is through social media platforms. So we have images, these are North Carolina families. We have scripted text that you can include. And then we also have, in addition to the reels I just mentioned, these short little clips here that we worked with Charlie's Kids, a big Safe Sleep nonprofit group here in the United States to help promote safe sleep. And so we co-branded those short videos there. So I would just encourage you to check those out. And, again, we are just here to help support the work that you are doing on whatever part of that map, that roadmap, that you're engaging with families. So thank you so much for just this time to plug Safe Sleep NC. And again, I really appreciate what you all are sharing. I think it's right on target of what we're hearing from the community of what's needed and really the best way to engage parents. So thank you so much. I'll go ahead and stop sharing.
So much, Megan.
And thank you. This is so wonderful and very synergistic, as you have outlined, Megan. Perhaps before we open it up for discussion, Neha has a handful of additional slides, which actually go in more depth around how we know what people's priorities are from a community participatory research method. And so I think there are 4 or so. So maybe a few more minutes of us sharing, and then we can discuss as you all like.
Yeah, I'll go ahead and share again then my screen and slideshow. So the second project that I got a chance to work on with the Durham Infancy and Sleep Center is around a new method. I don't know how new it is, but it's a method I had never heard of before, called photo voice. And it was centered around asylum seeking and refugee mothers in Glasgow, Scotland. So we were really looking to hear from them and hear what their perspectives are. So we use the method photo voice, and it's basically a method where members of a community take pictures of what their experiences are, what issues they believe exist in their communities, and they provide these images to researchers and to policymakers and to anyone who can illuminate that conversation around what those issues are, and then provide information related to why they took those images and kind of an explanation about what the issue that they're trying to represent really is and means to them. So it's really hearing from their perspective in a way that you can't really do through things like, interviews where you're leading a discussion with them and things like that. So these images are really raw and straight from their perspective, and that's kind of their reasoning behind it. So first, it allows for the direct involvement of these community members because they are the ones taking photos, rather than being asked questions that the interviewers thought were the most relevant. They're providing what they think is the most relevant by taking these pictures in the first place. It also eliminates any bias or not any bias, but some bias from researchers, because it allows, again, like I said, for people to choose what they find most important and present it to people who are doing research projects, rather than being prompted about something that researchers may think is the problem. And then also it's able to often eliminate things like literacy barriers and language barriers, because again, the medium is photography. And so you can't, a picture shows what it shows, right? So you see a picture and you can interpret it, and then you can hear what the photographer's interpretation is from that picture. And that really provides like so much information about what issues are at hand for communities. So I think it's a really innovative and interesting anthropological research method that can really allow for a lot more participatory research to occur, because again, we're putting these cameras in the hands of people who are directly affected by the issues at hand. So the project that I got to kind of get started on with the Durham Infancy and Sleep Center was in partnership with a nonprofit in Glasgow called Ama Birth Companions. And so they are a nonprofit that works with these refugees and asylum seeking mothers in Glasgow and in the temporary housing communities in Glasgow. And they have a lot of connections with the existing community and also with people who are seeking to do research with these communities. And so they really facilitate these partnerships that are much more ethical and more participatory for the communities that are being studied, which is, like, of course, so important when you're looking to understand the issues that these communities are facing. So what they did was they reached out to the Infancy Center and Sleep Center and said, we would love to have a partnership with an academic institution and really create a strong research project that demonstrates what safe sleep looks like in these temporary housing assignments in Glasgow for these people who are seeking asylum or who might be refugees. And a lot of discussion kind of went around what might be the product of these images coming from this community. So one example that we discussed was there's no elevators in a lot of the buildings that these families are being placed in. And so an image that could be relevant, for example, this is also just completely out of everyone's imagination and not a real image that was shared. But one example could be a picture of the staircase that is a barrier between a mom on the 14th floor and the kitchen on the first floor and trying to get the nutrition that she needs to breastfeed her baby in that housing situation. So, and then, hearing the photographer explain that situation could really provide the really good context for what the issue is, but really speaks so plainly to, that image of the staircase is so clear that, like, that is, like, the issue at hand. And it might not be something that we imagine beforehand as researchers, and it's something that they share with us directly. So they reach out to us for that collaboration. And so I got to be part of the training process and implementation process of the Photo Voice project. So when we were training the researchers, the sort of flow of people involved in the project was the Durham Infancy and Sleep Center coordinating training for community researchers who are members of the community in Glasgow, who would then provide people around them with the cameras to take photos, and then would receive the images back from those people and ask them questions about it. So we as researchers were simply training the people who are community researchers who would do the facilitation of discussion around the images. So when we were discussing with them what the project looked like, these are just some of the main important points we wanted to discuss with them before the project began. So first, we wanted to make it really clear what the goals of the study were. So to make it clear that we weren't looking for a specific result from them, and that we really wanted to understand what they saw and what the people around them saw as biggest barriers to safe infant sleep for their families. So that was one of the main things that we discussed first. And then, of course, we went into the more finer details of what research ethics looks like, how to obtain proper consent from people you're interviewing, and how to facilitate discussions in a way that prevents harm and is confidential among the interviewers and community researchers, and then the community members who are taking the photographs. And then we had them test the technique themselves that day when we were with them. So we had them take their phone cameras and go out and capture what lunch in Glasgow is like. And then to consider what the difficulties may be around a prompt like that. Some of them were like, what do I take a picture of, like my food or something? And we were like, well, it's really up to you. What do you think this is like? We're not looking for something specific. So we got to really emphasize that point to them, that we're not looking for a result. It's really what they find to be most important, so that they can then communicate that with the people who they're distributing the cameras out to, it was a really fun time as well. I really enjoyed that day too. And then we also talked about how to collect the data and make good interview procedure with the discussions around the photos. So things like, don't ask leading questions, really just ask open-ended vague questions that allow for them to really explain what their thoughts are. don't try to put words in their mouth, all of those sorts of framings for the discussions. We walked through some examples, we tried it out together. And, you know, for example, there was a picture of a burrito that someone had bought for lunch. And I said something like, oh, like, is it like a good burrito? Do you like it? And they were like, oh, you're leading me with that. And I was like, exactly, like, I shouldn't be asking you if you like it. I should just be asking what you think of it, right? So that kind of example is very useful in a low stakes environment beforehand, just to test out the technique. And it's also a lot of fun. I think it's a very cool and innovative technique to use as well. So that's just a little bit about the Glasgow project. I want to turn it over to Dr. Tully to talk about how it's being used in North Carolina.
Thank you, Neha. And your work is so excellent. I think a beautiful example of research justice, where if there's a community priority that they then want partnership around, and being known, I think that's the dream of being an academic center and being useful, and then being contacted and able to be responsive, so that then you can be supportive of community priorities. So that is what research justice is, using institutions, using funding mechanisms to be useful in a way that is driven by the people that you're seeking to serve. And so there are a lot of folks doing that very well, including Dr. Alex Lightfoot at UNC Chapel Hill, who led this project a few years back with Latino teens around their access to healthcare. And I'll put the open access article in the chat. I just wanted to highlight that here in North Carolina, it's been effective to partner with people to ask what their views are with healthcare experiences, their perceptions of treatment. And Photo Voice is very action oriented about, what would we like to come out of this? So what, in this case, what do they desire their relationships to look like? And so in this example, they partnered with 13 teens in North Carolina, and as Neha outlined, gave in a community-based organization, El Pueblo, and gave them cameras, and then had multiple group meetings for the individuals to share and to interpret and generate action steps together. Next slide, please. And one of the themes that came out of that work was this, image of a closed door. And it's really interesting reading the article, because some of the participants, then they staged things, that were, so it's not only, walking around and taking photos of things happening in real time, but you can think about what your experiences have been and what it feels like. I think that's why it's so appealing to me, because it's very empathy driven. And then you have group discussion around these like salient photos, and people interpret it together. And so one of the things that came out is like this closed door. It's hard to develop good relationships with doctors because they don't seem to care about who we are as Latino or Latina youth. And maybe they don't want to know. And so there's a lot more detail, but I just wanted you to see what this kind of work looks like, because I think it's incredibly powerful across a whole range of topics, especially with something so sensitive as infant sleep. And I hesitated saying that because almost everything is with family life, right? With infant feeding, with asking for help, right? With receiving that, and with being in community. These things are deeply felt, but it's sometimes hard to articulate. And so giving structure for that and this sort of work is really exciting.
All right, so that's all we have. if we're happy to discuss more, answer any questions. I'll just hand it back and stop my screen share now.
Thank you so much for being here in the presentations. This was really great and rich. I am going through the chat. There's a lot of great resources and links in the chat, so please be sure to scroll up and look for those resources. Do we have any questions? Neha, Kristen, or Megan Kennedy? I'm going to go ahead and put the evaluation for today's session in the chat. And then I also wanted to end the year showing one of our hot off the press videos. As you know, we've been doing postpartum video reels with Nurse Nikki on maternal health warning signs. And we've been taking our postpartum toolkit. So we've been taking some of these tools like the new parent birthing health information one pager and then turning it into a video reel. So it's taking the content about what, who to call, when to call 911, when to call a provider, what are some postpartum recovery red flags, what are ways to manage pain, to take care of yourself, things like that. So we have a series with Nurse Nikki, and we have a new video this week that we're launching. So I'd like to premiere it here if you wouldn't mind sticking with me. Again, here is the link for the evaluation. Please do scan that QR code or check the link in the chat and submit that for us. It's always helpful. Our next community practice is January 18th. It'll be on Medicaid expansion. So please do look out for an invite there. Mark your calendar. All right, hopefully it's not too far.
During the postpartum period.
And without further ado, I'm gonna watch it on YouTube actually.
Hey, it's Nurse Nikki, and I'm back to talk to you about taking care of yourself during the postpartum period at home. Hey, it's Nurse Nikki, and I'm back to talk to you about taking care of yourself during the postpartum period.
A place for touchdowns to be passed down from generation to generation. To generation.
So sorry, y'all. Technical difficulties. My screen's trying to play it in like a bunch of browsers now. We're just gonna play it from the presentation because it's going crazy. Sorry about that.
During the postpartum period at home. In videos 1 and 2, we covered when to call 911 or contact a healthcare provider. Here, we're going to talk about recovery and managing your pain. Let's get into it. Following birth, apply ice packs or padsicles to your bottom to help with pain and to reduce swelling. You can make homemade padsicles by applying aloe vera and alcohol-free witch hazel to pads, then freezing them. After a day or so, warm compresses or soaking your bottom in warm water can feel soothing. Consider using a squirt bottle of water as you pee. You can also use it to cleanse the area after you pee. This will reduce any stinging to tears in that area. Prevent constipation and hemorrhoids by drinking plenty of water, eating fiber-rich foods like veggies and fruits, and taking a stool softener if you need it. Bleeding after birth, called lochia, is normal, and quarter-sized blood clots are common the first few days. Bleeding should lighten and taper over a few weeks. Change your pad regularly to keep fresh and watch for any unusually heavy bleeding. Bleeding through a pad an hour is an urgent matter, and you should contact your healthcare provider. If you've had a C-section, stay on top of ways to manage your pain, such as taking your pain medication prescribed by your doctor. A number of nerves are cut, and you may feel a burning or tingling sensation as they heal. This is normal. Use a pillow to brace against your incision if coughing or sneezing. Don't try to lift anything heavy. Remember to be gentle with yourself and move slowly. It can take months for the incision area to feel normal. If you've delivered vaginally, it is still important to use your pain medications such as acetaminophen, Tylenol, and Motrin or ibuprofen to help control pain and cope. I hope these tips help in your recovery journey. You will feel better, and you matter. Hey.
Okay, yep. All right, y'all. We're so excited. I can go ahead and share that link. Please do share it far and wide. As a reminder, we do have the postpartum toolkits where our clinics, our teams in North Carolina are able to order prints shipped directly to you, to your home address, to your clinic site, with all of the different tools in color, in English and Spanish, with overview documents of how to use them, how to introduce them to your teams. So please do go ahead and I can put the link in the chat on how to order those prints, or you can find it on newmomhealth.com/healthcare. And that is all we have for you today. As a reminder, January 18th is our next session. I want to thank Neha and Kristen and Megan again for this wonderful. I so appreciate everyone's time and this really great presentation of systems approach and different ways to innovate and to care for families and communities in such an authentic way. So thank you, everyone. I hope you have a wonderful holiday season. Take care.